The next competitor is Cho-Hee Shrader, a Ph.D. student in prevention science and community health. The title of her dissertation is The Influences of Spatial and Social Network Factors on PrEP-Related Disparities Among Latinx Men Who Have Sex with Men. Her advisor is Mariano Canamori.
Do you ever wonder why you're friends with your friends? Well, according to the social network theory of homophily, you're friends with them because you share a similarity. Like the phrase, birds of a feather flock together, you are more likely to be attracted and befriend people who are similar to you in some way. Homophily is important to society, especially now. Think about those friends that you have COVID-related conversations with. How are they homophilous or similar to you? Unfortunately, this tendency for homophilous networks to have conversations within themselves means that minority networks are left out of the conversations of majority networks. We see this happening right now in Miami with pre-exposure prophylaxis, or PrEP. PrEP is a pill that can be taken every single day to prevent your acquisition of HIV. And although the FDA approved PrEP for HIV prevention 9 years ago, there are still communities who cannot access this life-saving pill. One of these communities are Black and Latino gay men living here in Miami. Not only is Miami the epicenter of the US HIV epidemic, but also the CDC estimates that 20% of Latino gay men and 50% of Black gay men will be diagnosed with HIV by the age of 50 if current trends persist. Well, my dissertation hopes to disrupt this trend. I identified how homophily is associated with PrEP-related conversations within the friendship networks of Latino gay men. I used a statistically advanced social network model for my analyses. Allow me to share two findings with you. First, homophily on cocaine use, meaning both friends use cocaine, is associated with PrEP conversations. This means that PrEP education can be incorporated into cocaine and drug use prevention programs. Second, homophily on race had the opposite effect of what we originally theorized. Latino gay men who are of the same race are less likely to tell their same race friends and encourage them to use PrEP. Why? Stigma. These friends may have networks which overlap, and these overlapping networks may discourage them from talking about taboo topics like sex, HIV, and PrEP. The NIH funded my dissertation to understand how homophily creates connections and how these connections can disseminate life-saving information. Think again about your friends that you talk to about COVID with. These conversations, if constructive, could actually destigmatize the virus, the vaccine. And if the vaccine is destigmatized, then we can increase vaccine uptake in society and save hundreds of millions of lives. And as with COVID, HIV is here in our backyards. And my dissertation on homophily could perhaps be the missing key to unlock the strategy to finally end the HIV epidemic. Thank you very much for your time.